Earlier today, the World Health Organization took the unprecedented step of raising the infectious disease alert level to phase 5 out of 6 phases, setting the stage for increased efforts to combat swine flu. On Sunday evening, Commissioner Baker and I announced that the city's health department had been preparing and would continue to prepare to respond if the infection reached Milwaukee. It now appears certain that swine flu has reached Milwaukee. As we make decisions affecting the flu, I want to emphasize that the decisions we make are based on what's best for the health of the residents of our community. Specifically, there will be several announcements made regarding our schools, 4 Milwaukee Public Schools, and the decision we're making that will affect the students and staff of those schools for tomorrow and Friday in particular. I'm now going to turn it over to Commissioner Baker to talk about the cases that have been probable cases that we believe are cases of swine flu in Milwaukee. Seth Foldy from the state of Wisconsin will talk about a 3rd case that's not located in the city of Milwaukee. Commissioner Baker.
Thank you, Mayor Barrett. Good evening, I'm Bevan Baker, Health Commissioner for the City of Milwaukee. I have 3 important points to convey to you this evening. First, the City of Milwaukee Health Department is reporting that Milwaukee now has its first 2 probable cases in a nationwide outbreak of swine flu. Those 2 cases are 1 adult and 1 child. Dr. Seth Foldy, the State Administrator and Health Officer for the Division of Public Health, will address the statewide concerns. Second, we have identified a number of children who have symptoms consistent with swine flu who were in contact with this case. Those children have attended several Milwaukee public schools. Therefore, to protect the public's health, I have ordered those schools to be closed until further notice. Those schools are Mitchell Street School, located at 1728 South 23rd Street. Riverside High School, located at 1615 East Locust. Clement Avenue School, located at 3666 South Clement Avenue. And Rogers Street School, located at 2430 West Rogers. Third, because of the facts here and the fact that the World Health Organization has raised the pandemic level to level 5, we're now making the recommendation that any person in Milwaukee who has symptoms consistent with influenza stay at home from work or school and contact their healthcare professional. Those symptoms include fever, cough, sore throat, running, and stuffy nose. Because we now have disease in our community, people with these symptoms should stay at home even if they've had no history of travel to other places that have had swine flu. These recommendations are additional to our prior recommendations that encourage frequent hand washing, careful covering of nose and mouth when coughing or sneezing. We've taken these actions in our community today to slow the spread of disease. We know that disease is existing in neighboring states, so we're trying to slow it here. We want to assure you that the City of Milwaukee Health Department is working closely with local, regional, state partners in these efforts, and we're following our pandemic preparedness plan, which we invoked earlier this week and that we developed over the last 3 and 4 years. For those issues, we're taking the monitoring and recommendations from the Centers for Disease Control, and we are following those very closely. Again, I want to emphasize that this investigation is rapidly unfolding. It's rapidly unfolding here locally and globally, and we must all pitch in to follow these recommendations so that we can minimize the impact of disease on this community. I also want to make mention that our hotline is currently live, and will be live for a few hours later than today, and we will stand it up tomorrow. And to now address the statewide concerns, I want to have Dr. Foldy come to the podium.
Thank you very much, Mr. Baker. As just been announced, 2 cases of probable swine flu influenza have been reported from inside the city of Milwaukee. There is a third case that has been identified in Adams County, unrelated to our knowledge to any of these two cases. And local and state public health officials are investigating all of the circumstances related to all three of these cases. This, as has been previously stated, should not be a surprise at this point. We have been anticipating and planning for the possibility of new strains of influenza for several years, and we have certainly been searching extremely actively for cases of the new swine flu variety for several days. I do want to note that Milwaukee's actions regarding the schools and regarding public advice are 100% consistent with the state's own recommendations. I also think it is time to commend the citizens of the state, media, many different agencies in state, and all of our local government partners, as well as many, many private organizations, for the steps they've taken over the last week to be prepared for a time like this. In terms of recommendations, what does this mean for the general public in Milwaukee and statewide? As before, those with fever, cough, congestion, or sore throat should stay home from work or school or recreational activities. As Mr. Baker has mentioned, this is regardless now of their travel history. Those who do have these symptoms and a travel history to other affected areas or contact with known cases here should consider contacting their physician about testing for the swine flu virus. We recommend that all people stay 6 feet away from those who are coughing and sneezing, and that the general public use frequent hand washing and, of course, covering coughs and sneezes in order to reduce the risk of transmission hand to hand. Also, at this point, we've certainly reached a point where businesses and schools should be actively encouraging employees who are sick to stay at home as well. Obviously, they can contact their physician if they're in need for medical assistance, but sick people should not be going to work or school. This includes those with respiratory symptoms and fever. And finally, given that school closings are now occurring in a few schools in the city of Milwaukee, now will be a very good time for businesses to review their plans on what to do if some portion of their workforce are forced to stay at home with sick children, because this may not be the end of the story. Thank you very much.
Bevan Baker, can you tell us more about the adult and the child involved here? And you're saying probable case, not confirmed. When will you know that? And how do you think they became infected?
Certainly, once again, our investigation is rapidly unfolding. I don't have any data regarding the child or adult other than that they are in that category. Final confirmation on these probable cases are going to happen at the Centers of the Disease Control level, and their samples and those specimens are currently in the hands of the Centers of Disease Control.
Is your concern that they have been potentially exposed to dozens, hundreds of other people, and that's why you're closing the schools?
Certainly, this is a prudent and precautionary measure that I've taken here along with my colleagues. Our goal is to minimize the spread of disease in this community, and we're looking at case definitions from the Centers of Disease Control, our own state health department, and our health department to minimize spread. And these are the actions that we believe that will help us mitigate and hopefully fan out the flames of this swine flu.
Can you describe the relationship between this adult and this child with these schools, how these schools came to be associated with them? Is the child a student? Is the parent or the adult a teacher or a parent? And finally, does either of them have a travel history?
That information at this time is not germane to our investigation. We can say that this is a contact that has resulted in meeting the case definition for us to take this action. We will go so far to say that that probable case has presented itself and to a child that now has symptoms consistent with influenza, and therefore, based on the recommendations of the state and the Centers of Disease Control, we have to take this preemptive action to protect all students at those schools that are implicated.